discussion that I think may feature into that. Further understanding of the factors that influence these incidents in primary care settings with particular consideration for the cognitive deficits of human performance is needed. And I think that's the bit I liked, because it's talking about behavioural elements that, again, we've mentioned many times.
I think what we should say about this is that, for example, in the UK, I know for a fact that Janice Perkins, who heads up the Community Pharmacy Patient Safety Group, they've worked really hard at this kind of thing. And although I've said that the reports that come into the NRLS are pitiful, and they are in comparison to what gets reported in hospitals, like tiny percentages, they have got a group of both national groups, if you like, so, big companies, plus MPA and others, to look specifically at like what people call LASSers or salads, look alike, sound alike. Because the thing about reporting is to find out and then go, okay, we've got an issue, how are we going to fix it? And by actually, if you can fix it, using a technological advance, then great. You want some way of being able to do it so that it's less likely to be affected by humans, essentially. So there is a lot of good work going on in the UK about this. So I was just disappointed because this isn't telling me anything that we didn't know, 10 years ago. And the key has to be about how do you change the system to be able to reduce that risk of happening.
Sure to encourage our Australian audience there. They'll be beating a path to our door.
As I said, it was 10 years ago. Their culture may have changed beyond recognition.
The bit I linked with as well was patients are not passive victims of error and medicine use in the unsupervised community setting is affected by patient decisions and behaviours. Relatively few studies, and that sort of have demonstrated. That links back to that DTB article we talked about in Series 1, doesn't it? Okay, we know we'll be revisiting that many times. Please get in contact, Australian audience.
The Purple Pen podcast awaits.
Oh yeah, I forgot about that.
Yeah. A big thank you to Jill for joining us on the Oral Apothecary and for sharing her Desert Island Drug, her career anthem and her book. Coming up next time, we will be joined by Professor Rachel Elliott. Rachel is a pharmacist and Professor of Health Economics at the University of Manchester. Her research will be known to many of you as it informed UK policy change over the years. Rachel has been involved with the development of the PINSA study and the New Medicines Service. And so we look forward to catching up with Rachel next time on the Oral Apothecary. Over to Gimmo now for our contact details and the final ingredient.
Yeah, so if you want to engage with us on Twitter, it's at Oral Apothecary. Thank you very much for everyone who does. And if you want to email us, it's at oralapothecarypod@gmail.com. Someone on social media actually this week, Twitter name, if I pronounce this right, The Gentleman. He actually described the pod in 4 words, and it was one of the shortlists for the title of this pod. So can you remember some of the names that we had in the hat when we were trying to work it out? Name of an album, Steve?
Oh, Pills, Spills and Bellyache.
Pills, Thrills and Bellyaches, isn't it?
Thrills, yes.
So well done, gentlemen. Okay, so the final ingredient. Would you like a hug?
Yes, please.
One of the things in the news, isn't it, is that I think it was last week or the week before that, and again, anyone listening in the future will think that we're crazy, but it was legal to hug again because it's been illegal for the last year. But hugging isn't just a nice thing to do; it comes with quite a lot of health benefits. So the reason hugs feel so good has to do with our sense of touch, and this is from an article in The Conversation. And touch is an extremely important sense which allows us to physically explore the world around us, but to communicate with others. And there are 2 distinct systems in hugging and in touch. Fast touch, which is your sort of nervous system, and slow touch. And this uses some recently discovered nerves called C-tactile efferents. But there are 4 benefits to hugging. It improves our sleep. It reduces reactivity to stress. It increases well-being and pleasure. And for us, in the healthcare profession, it helps us to fight off infections. So, if you're feeling a bit down, or you think you're coming down with something, let's all have a hug.
Or a cwtch. This was a 3 Apothecaries production. Sound engineer, Jimbo Slough. Original music, Jamie Brewster. Artwork by David Baker.
Thanks for listening to the Oral Apothecary podcast. It's all about pills, thrills and bellyaches.
This episode of the Oral Apothecary is sponsored by OneLessPill.com, a medicines optimization consultancy.